11I circumflex superscript 2 hydroxylase deficient congenital adrenal hyperplasia is an uncommon form of congenital adrenal hyperplasia resulting from a defect in the gene encoding the enzyme steroid 11I circumflex superscript 2 hydroxylase, which mediates the final step of cortisol synthesis in the adrenal. 11I circumflex superscript 2 OQA results in hypertension due to excessive mineralocorticoid effects. It also causes excessive androgen production both before and after birth, and can virilize the genetically female fetus, or a child of either sex. Congenital adrenal hyperplasia refers to any of several autosomal recessive diseases resulting from defects in steps of the synthesis of cortisol from cholesterol by the adrenal glands. All of the forms of CAR involve excessive or defective production of sex steroids, and can prevent or impair development of primary or secondary sex characteristics in affected infants, children, and adults. Many also involve excessive or defective production of mineralocorticoids, which can cause hypertension or salt wasting, respectively. The most common type of CAR is due to deficiency of 21-hydroxylase. 11I circumflex superscript 2 hydroxylase deficient congenital adrenal hyperplasia is one of the less common types of CAR due to deficiencies of other proteins and enzymes involved in cortisol synthesis. Other uncommon types are described in individual articles. 11I circumflex superscript 2 OCAR resembles 21-hydroxylase deficient CAR in its androgenic manifestations. Partial virilization and ambiguous genitalia of genetically female infants, childhood virilization of both sexes, and rarer cases of virilization or infertility of adolescent and adult women. The mineralocorticoid effect differs. Hypertension is usually the clinical clue that the patient has 11 rather than 21-hydroxylase CAR. Diagnosis of 11I circumflex superscript 2 OCAR is usually confirmed by demonstration of marked elevations of 11-deoxycortisol and 11-deoxycorticosterone, the substrates of 11I circumflex superscript 2 hydroxylase. Management is similar to that of 21-hydroxylase deficient CAR, except that mineralocorticoids need not be replaced. Mineralocorticoid manifestations of severe 11I circumflex superscript 2 hydroxylase deficient CAR can be biphasic, changing from deficiency in early infancy to excess in childhood and adult life. Salt wasting in early infancy does not occur in most cases of 11I circumflex superscript 2 OCAR, but can occur because of impaired production of aldosterone aggravated by inefficiency of salt conservation in early infancy. When it occurs, it resembles the salt wasting of severe 21-hydroxylase deficient CAR. Poor weight gain and vomiting in the first weeks of life progress and culminate in life-threatening dehydration, hyponatremia, hyperkalemia, and metabolic acidosis in the first month. Despite the inefficient production of aldosterone, the more characteristic mineralocorticoid effective 11I circumflex superscript 2 OQA is hypertension. Progressive adrenal hyperplasia due to persistent elevation of ACTH results in extreme overproduction of 11-deoxycorticosterone by mid-childhood. DOC is a weak mineralocorticoid, but usually reaches high enough levels in this disease to cause effects of mineralocorticoid excess. Salt retention, volume expansion, and hypertension. Because 11I circumflex superscript 2 hydroxylase activity is not necessary in the production of sex steroids, the hyperplastic adrenal cortex produces excessive amounts of androstenedione, and especially testosterone. These androgens produce effects that are similar to those of 21-hydroxylase deficient CAR. In the severe forms, XX fetuses can be markedly virilized, with ambiguous genitalia that look more male than female, though internal female organs, including ovaries and uterus, develop normally. XY fetuses typically show no abnormal features related to androgen excess. Amegalopenice is usually present in male patients. In milder mutations, androgen effects in both sexes appear in mid-childhood as early pubic hair, overgrowth, and accelerated bone age. Although non-classic forms causing hirsutism and menstrual irregularities and appropriate steroid elevations have been reported, most have not had verifiable mutations, and mild 11I circumflex superscript 2 hydroxylase deficient CAR is currently considered a very rare cause of hirsutism and infertility.